Okay, first thing I would do is I would log on to the EMR, select my correct patient profile. Then I would review the orders, make sure I have the correct date and time. So it is November 5th. November 5th, I'm giving this at 1100, which is the time that it's due at, so the EMR. And then the allergies are, he has an allergy to sulfa. Next, and he'd be taking metoprolol 50 milligrams orally. So I would be taking my handbook and looking for metoprolol, seeing that it is for hypertension. You can take with or without food. Normal dosage is 50 milligrams 2 times a day for adults. And then since it's for hypertension, you would want to take BP before giving it to make sure that the BP was at a good enough level to be able to give it. Next thing I would do is I would log on to the AccuDose over here. I would then check the check the allergies again. So allergic to sulfa, allergic to sulfa right here. And then I would compare the EMR and the AccuDose with the 6 patient, right? So this is Michael Head. Birthday's 9/24 of 1944, 9/24, 1944. It is 1100. I'm giving this at 1100, so 1100. We are taking metoprolol 50 milligrams oral. So metoprolol, this is a 100 milligram tablet. So tablets can be given orally, so that's fine. But route metoprolol. Since the EMR says 50 milligrams and the AccuDose dispense is 100 milligrams, I would have to cut this in half when I would give it. And then for documentation, then I would have to document it after the patient swallows it, so not at this time. Next, what I would do is I would dispense the medication out of the AccuDose, compare it. So metoprolol 100 milligrams, metoprolol 100 milligrams. It is 12/22 as the expiration date, so it has not expired yet. The package is also intact. Next thing I would do is that I would log out of the EMR and AccuDose. I would gather my supplies I would need, so I would need a medication cup for this medication administration, and then I would go to the correct patient bedside. Once I got there, introduce myself to the patient, identify the patient with 2 identifiers, name, date of birth. So it's Michael Head, 4/24 of 1944. Next, what I would do is that I would explain what I was doing. So I'm giving you a oral medication, and then I would also wash my hands. And then I would explain the procedure to my patients, the medication to my patients. So I'm giving you metoprolol, it's for your high blood pressure. So next what I would do is that I would scan the patient wristband and then check for the allergies again, the allergy to sulfa. Next what I would do is that I would scan the patient's, scan the medication. This is where I would change the dose to giving half a tablet for 50 milligrams because these are 100 milligram tablets, so I'd have to cut it in half. And then I would scan the patient again before administering, again, probably checking the allergy band. Next I would do is I compare the patient's patient's band and medication to the EMR that I would have logged into before scanning. So this is Michael Head, date of birth 9/24, 1944, 9/24, 1944. He's allergic to sulfa. Time due is 1100. It is a little past 1100, so I'm still within the amount of time able to give. Today is November 5th. I'm giving metoprolol, 50 milligrams. So metoprolol, this is 100 milligrams, so I need to cut this in half before putting it in the cup. So I cut it in half, and then I put it in without touching it. Then what I would do is it would be an oral, so it would be a tablet, so this is going to go orally into the patient's mouth. And then I would document it after the patient swallows. So next, I would sit the patient upright. I would give them the medication, observe them swallowing it. Then I would document that the patient swallowed it, and document any type of medication that they refused to take or did not take, and then make sure I document that it was at the correct date and time. Then I would scan my badge, verify that it was confirmed and went through with the correct date and time, and medication passed. Then I would log out of the EMR. So I would log out of this. Then I would set my patient down, or lay my patient back down, bed in the lowest position, side rows up ×2. Then I would also put their items and call lights in reach, and then just make sure that they're comfortable. And again, I could, if I wanted to, confirm that the medication went through.